Welcome back. Today we are expanding on a topic that a lot of you guys resonated on last time, the lower traps. In that first video of the lower traps, you guys learned the strength of the lower traps and how important it is. But today we're gonna be talking about the activation and the timing of that muscle. This is important because everything that we do, whether it's sitting at a desk, whether it's working out and doing a lat pull down, or just raising your arm up in the cabinet to grab something, your lower trap is activated. But we have to make sure the timing of that lower trap is in the perfect sequence. So I'm gonna walk you guys through what I typically do with a client in our physical therapy sessions. I love to break it down, give the visuals, give the animation, and kind of make it make sense to you so you can make sure that you're doing it going forward. When we talk about the scapular force couple, we have three muscles that are involved. We have our lower traps that come from here. You can see the vectors of the arrows of what the direction they should be going in. So we have the lower traps pulling from here. We have our serratus anterior that pulls from this direction. Then we have our upper trap that comes from up here. A lot of the times people have way too much upper traps and they don't have the usage of their lower traps and of that serratus anterior. But when we play this animation, you can see where these are involved and why it's important that they're involved. So that low trap is pulling from this angle, serratus pulling forward, the upper trap pulls from there. They work in a triangle unit formation, and each one should have the perfect timing and strength, and one cannot be compensated the other, or we're gonna have that imbalance in that shoulder blade. But what you can see is when people have way too much of the upper trap usage, their arm is just gonna lift up here like thatwards. We're not gonna see that depression of the shoulder. We're not gonna see it rise up like that. And that's how sometimes people get impingement in their shoulder blades or their shoulder joint. So it's thinking about those muscles. Like I said, they work kind of like in a triangle unit formation in all different directions. If I draw it out for you, it'll kind of make sense. So we have a triangle. We have the lower traps pulling from this direction. We have the serratus anterior pulling from that direction. We have the upper traps pulling from that direction. If we have too much upper traps, which is a lot of people's problems, what you're gonna see as that shoulder blade is gonna rise and it's gonna ram up into the roof of that acromion that's up here. Essentially, that's what gives impingement to people's shoulders. So this is where we need the activation of that lower trap. You can see at the right timing as that arm comes upwards to depress in the shoulder as that serratus should drive it forward to clear this roof. So we're gonna apply the scapular force couple into something that I love to do, a shoulder swimmer. So what you'll typically see if someone has way too much upper trap usage and not enough of that lower trap and not enough of that serratus anterior, what you'll see is raise their arm up here. So go ahead and you'll see it's lots of upper trap. You see those guys just light up. But now what you'll see is when we get that to depress, so go ahead, you think about it depresses as the arm comes up and it helps us clear that what we called before, that acromion that's at the top of that shoulder that a lot of people get with shoulder impingement. This shoulder should drop as you come up and help clear that, okay? Do it one more without me. Do it the wrong way first. Wrong way with the upper trap, just recruiting and going everything there. Very typical, very common. The correct way where we get a little bit of this depression and it raises, but then right about there, we can kind of let it go because we want that serratus anterior to pull out that shoulder blade a little bit more. So let's take the application of that scapular force couple and the timing of that low trap and let's apply it to something like a shoulder swimmer. So what you're gonna do is you're gonna lay flat on your stomach on a bench. We're gonna start with our hands back behind us, okay? In a full internal rotation. Then you're gonna engage those low traps and those rhomboids. We're gonna rotate our arms around. Right about here is where you wanna think about depressing and dropping those shoulders down as we come up around, and then we're gonna bring our hands behind our head. Okay, we keep that position, keep our elbows nice and high, we're not having them low, have our elbows upwards, and then we're reversing the opposite way, come back down. Okay, what you'll do if you're doing it wrong, you'll see lots of upper trap. You don't think about the depression and you're just coming up here like this. So like I said, right about when you release those arms and you bring them around, you wanna think about dropping those shoulder blades to then bring those hands behind that head, okay? And then retract it, bring it back down. Engage again, fully, and then right about here, yep, good. Drop those shoulders, come up and around to your hands behind your head. The whole time you're still thinking about that low trap engagement. You don't wanna lose it. So you can see how that activation and that timing can really help when you're coming up and around to drop those shoulders. You can apply that into anything that we're doing overhead like that. Another movement that we can practice this lower trap activation and timing in is a lat pull down. Even my most advanced bodybuilders do not get the activation at low traps and they end up just pulling through their upper lats, which is not wrong, but if we want to get the most out of these movements, let's get those low traps involved. So to start with a lat pull down, we're gonna get underneath a pull down bar. And what I want you to think about doing, I'll show you the wrong way first, is a lot of people just want to pull straight down, which like I said is not wrong. It's going to build our lats, but It's not gonna get those low traps engaged. So what I want you to think about doing is actually depressing with those shoulder blades first, because like we talked about before, if you have so much upper trap usage and I'm gonna exaggerate it, but if you start and you're engaging like this, or you're just resting and sitting like this, if you go to raise your arms up and we don't think about that initial depression, and you're just gonna be pulling like this. We have to get those shoulders away from the ears first with our foundation before going into that movement. So look at it as like we're just building that foundation first. So again, we're just thinking about fully depressing our shoulder blades, and then we're gonna bring that bar downwards. Think about it, step 1, then step 2, and then we bring it back up, okay? Fully depress those shoulder blades, then bring that bar to that chest. And when you're rising back up, you're still thinking about keeping your low traps engaged until about 1/3 to 2/3 of the movement. Right about here, we can kind of let them go a little bit and get a little bit more of that stretch. But again, fully depress and then pull up through those upper lats. Another way we can practice low trap activation and timing is with a lat pull down. So I'm gonna have Donald here show me how he typically does his lat pull downs. Do whatever you do without any instruction. So we'll see and we'll watch what he does with his lat pull down. So go ahead for me, just pull straight down. We're gonna do 3 to 5 reps. So it looks pretty good. You can see him pulling up for those upper lats. You can see that engagement. You can see those shoulders moving as well. But again, we need to see more depression in that shoulder blade. So what I want you to think about first doing is first depress those shoulder blades. So get out of those upper traps and depress those shoulder blades, get those low traps and those low lats. It's not just lower traps in this one. We want those low lats that are down here. And then we will pull down through those upper lats, okay? And then what I want you to do on the way up is you keep this tight. Keep it tight, 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 tight until right about here. You can let those shoulder blades come out, get a little bit more of a stretch, and then fully depress again. Depress through those shoulder blades, yep, and then pull through those upper lats. For this last exercise, this is probably one of the most advanced lower trap exercises. Like we talked about in that first video, the most activation of that low trap is in a Y position here. So that's what we're gonna do, is a Y raise. We're taking gravity out of it and we're adding weight with it. So we're gonna set that cable height to around about slightly below hip height. We want it to be coming from a downward angle. Okay, so we'll set both of those cables to be around hip height. You want some light weight here. We start with the lightest possible weight that we can, and then we progress from there. Do not be ego driven. Get that weight controlled before we move on. Okay, so we're gonna connect those straps, and then what we're doing here is we're gonna do a cross cable Y. Cross our arms, and what we're not doing is we're not just gonna pull through our rear delts and bring our arms backward and get no low trap activation. I want you to think about it's the timing of this muscle. So you're not just locking it down either and then pulling through, because that means we're just pulling again through those posterior deltoids. So it's almost like you're engaging that muscle as those arms come backwards. And my sole focus is on those lower traps. I'm not even thinking about what my arms are doing. My arms are just dead weight, allowing me to perform this movement and pull back, engaging through those low traps. Keep pulling with them, keep pulling with them. It's a hard movement if you're doing it correctly. Okay, and then bring it back down, reset. On the way back down, that's also a hard piece that even myself, I'm still working on, of keeping it controlled on the way back down. You wanna make sure when you come up, you're not letting those shoulder blades just kind of round forward. You wanna keep those low traps engaged on the way back down as it eccentrically lengthens on the way back down. We're gonna have Donald do these first, so everything that we just talked about, engaging those low traps first, then we keep those arms straight as we come up, okay? And then bring it back down, we'll correct, we'll give you one more rep, and then I'll make a change. Not too bad. We're definitely pulling a little bit through those rear delts, a little bit more, so don't think about this moving first. I want everything, so engage, and you're doing too much in the beginning, so it's almost like it's as you come back, those arms are moving and coming upwards. Okay, again, it's lots about the timing. Okay, so go ahead. It's pull from here. Yep, pull, 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 as you come back. Okay, that feel a little different?
A little bit. And
then go again. Pull, 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 pull. Okay, and then keep this tight when those arms come back down. So keep it tight, keep it tight, keep it tight, till like right about there, you can let it go a little bit more. very typical movement that is done wrong a majority of the time. This is why I don't even give this to a lot of my patients, because it's a very advanced movement. It takes a lot of time for people to engage and get this muscle activated in that mind-muscle connection before we go into these advanced exercises. Thank you guys so much for watching this video. Hopefully now you are 100% confident in not just your lower trap strength, but the activation and the timing of it. So now go apply all these exercises into your everyday life, into your workouts, and really practice that. And don't forget, if you need that additional help, I do take people online, one-on-one. Everyone's issues are different. Everyone might have muscle imbalances in different areas. So please reach out to me and apply in that link down below to get that one-on-one PT.